Okay.
When you walk into a room and there's a sick kid, it can scare you.
Yeah. Hey, Mom, how long has this been going on?
It is a moment where you're saying, oh my gosh, this child is really sick. Is this child going to die because I don't have the right resources? And that is heavy.
Picky, we'll stop taking care of him and talk about this. All right.
The COACHES program is the Children's of Alabama Community Healthcare Education Simulation Program. So if a kid who's really sick comes into a rural hospital setting, not every hospital out in the community actually has an inpatient pediatric service. And our goal is to empower those hospitals in being able to care for those children until we can get there to bring them to us for them to have definitive care. And so we developed a simulation program that is designed to actually help us help them. And so what we do is we go to their hospitals and we provide education with what we call mannequins, and we practice with them on how to take care of these really sick kids.
So here at Baptist East, a lot of parents bring their children here. So I was here on Sunday, and I had personally 5 children just in my 12 hours. So we see children constantly here.
So on Tuesday we went to Baptist East. We've been to Baptist East multiple times. They've been a great partner with us at Children's and a part of the COACHES program from the very beginning.
Okay.
How do we determine if this staff knows where all of the supplies are for pediatric patients? How do we make sure that they are managing those pediatric patients the way that we would be managing them here at Children's of Alabama as well? And so during that day, that was our plan, was to assess their institution.
So at the beginning of COACHES, I was terrified. You know, that's always when you have to do a simulation. But it was very realistic. Most of our simulations that we have are not that realistic, so I was very thankful to be able to use all the stuff that we actually would use in a regular code.
The simulation in itself is where we actually give the learners the opportunity to take care of these real patients. All of the different people that are needed to take care of this patient will come in and start taking care of our mannequins, which are the patients at that time. They are able to give true medications to the patient. They are able to actually give IV fluids to them. They can listen with a stethoscope for heart sounds and lung sounds.
Like a real child. They start and they don't stop.
Our mannequins also can change color, and they can change and become, if we want them to look like they have low oxygen levels, we can make them turn blue. And they see that patient is turning blue, their oxygen levels are low, then they know, let's put oxygen on that patient. We want them to put the oxygen on the patient, turn the oxygen on to make sure that it actually is working. And then if we see that, we actually can change the vital signs to say, your interventions actually improve that patient. And that gives really great positive feedback to the learners to say, I'm doing the right things. I'm doing what I'm supposed to be doing. And that increases confidence in itself.
So now that I've gone through COACHES, I feel a little bit more confident on how I care for children. Say a child were to come in tomorrow or even 2 weeks from now, I can go back and say, I remember when we had COACHES, the Miller blade to intubate that child is in the bottom of that drawer. I know exactly where to go for it. There's going to be no hesitation. And so I can use those memories to help me move faster and be more efficient in future actual cases.
So COACHES has been going on for 5 years or so now, and so in the next 5 years, I hope that COACHES continues to grow. We want to just extend our reach as much as we can. We want to go anywhere within Alabama that we can go, so that we can make sure that we have achieved our overarching goal, which is improving the care that the children of Alabama receive throughout the entire state.